Hey Dr. Nourah, I've come to you with a few questions from our patients. First one, at what age should my child first see an orthodontist?
That's a great question. So the American Association of Orthodontists recommends that age 7 is the time at which you want to see an orthodontist. But I recommend to see a patient when they're 6 years old. And the reason I recommend that is if we know that we're looking into early treatment, then we can get the family prepared, we can get the child prepared, they'll get used to the office, they can come in for more of an observation appointment in 6 months, and then they'll be ready to start treatment in 7. There are also certain conditions for which I might have to start early, for example, an underbite. This is why I recommend that 6 years is the right age for you to see an orthodontist.
Will braces or aligners hurt?
They both do a little bit. I always compare it to how you feel like after you've had a workout. So when you work out your muscles, they're going to feel sore. It's the same thing with your teeth, whether you move them with braces or aligners. I will say it's a little bit more comfortable if you're doing Invisalign.
How long will orthodontic treatment take?
That really depends. It depends on a case-by-case scenario. It depends on if we're correcting your bite or if we're just correcting the alignment of your teeth, and how old you are. So if you're doing a phase 1, which is early treatment, when you still have baby teeth, your treatment time can be anywhere from 12 to 16 months. If you're older, a teenager or an adult, your treatment time can be anywhere between 12 to 24 months.
What's the difference between Invisalign and braces?
The simple difference is that Invisalign is clear, it's removable, which means you have more control over it. Whereas braces is fixed, it's working all the time, but you have more responsibility in terms of not breaking any brackets and keeping everything clean when you have braces on.
Do you know how much orthodontic treatment typically costs, and does insurance ever pay for it?
Good question, yeah. So orthodontic treatment would range anywhere between $5,000 all the way through $8,000, depending on if you are getting early treatment or comprehensive or a limited or a touch-up treatment. So again, it's very case-by-case basis, but that's a range that you'll be looking at. Insurance does cover orthodontic treatment depending on what kind of insurance you have. They usually cover up to 50% of the treatment fee.